English is a commonly spoken language in the capital. It's the official language of higher learning and business. In our area, the central area, the native language is Chichewa.
The people in Malawi, as others will tell you, are incredibly warm and generous and friendly, although there are people like that in other areas of the world. But it was the real need and the ability to really make a difference in people's lives there that I think attracted me to Malawi.
Actually, the statistics for the country as a whole would be about little more than 14% of the adults are infected with HIV. We live in the capital city, and so it has a higher rate. Many would say 20 to 25%. So basically 1 out of 4, 1 out of 5 adults is infected with HIV. I knew AIDS was there when I went. I read the papers and I knew the statistics. But it really doesn't hit you till you're knee to knee with the patient. And patient after patient, probably 60% of what I saw was undiagnosed AIDS. And I think that's been some of the struggle for people here to understand it's a very different epidemic in the rest of the world, especially in Africa, where it's really a disease that you get through heterosexual intercourse. Really, the vast majority of adults who get infected is through heterosexual intercourse. Children also get infected by mothers who are infected with HIV during the birth process. Once it gets entrenched into a heterosexual population, it really can get out of control, especially if people have multiple partners. And in 2000, actually, when I was treating AIDS patients, we didn't have the medicine that we have now to treat the HIV, and many of them died. But there was still a sense when I was with an AIDS patient that this is really what I came to Malawi to do. And so that's really what got me thinking and planning on how we could do this in a bigger way and a more significant way.
And so he started looking for a facility or a building and found one, and it was so over our heads that we realized that the only way it would happen is if God was involved in it. I mean, it was beyond the practical side of even the optimistic people who would have thought that something like this probably would work. But we formed Partners in Malawi, which is a nonprofit company here in California, and got a group of people together, and we called ourselves the board members, and we started supporting Perry emotionally and through prayer, and started raising money.
This road right here is called the M1, and it runs basically, in a sense, all the way from Cape Town to Nairobi, or even Cairo, really. Some people have called it the AIDS superhighway. It's really the main corridor, and there's a lot of truckers and a lot of commercial sex work that goes along this highway. And so there was a lot of HIV transmission because of the mobility of people from South Africa all the way up through Kenya. So it's appropriate that we're located right just a stone's throw away from the AIDS superhighway. Well, there's 12 million people in Malawi. In Lilongwe, the rates are probably more like 20 to 25% because it's a larger city with a lot more mobility and a lot more opportunity to contract HIV. Well, definitely there's a lot of death, especially when I first came. Basically, people who were diagnosed with AIDS, half of them would be dead within a year. So went through a lot of losses, and I think the hardest ones for me were the children that died, and they were often children that we had cared for pretty intensely, and so that is tough. And also people who die and leave children behind. I think those kind of have a special place in my heart. Having lost a child myself and had some tragedies, to understand how devastating that is for a family to lose a parent, or for a parent to lose a child. I think the thing that really keeps me going, especially now that we're able to offer treatment, is that the vast majority of people actually respond to treatment and get better. So if we have somebody that dies or doesn't do well, that same day I've also seen 10 patients who wouldn't be alive today if they weren't on the treatments that we're providing. So it really is a huge privilege. In Malawi, if someone has HIV, they actually have about 40% chance of dying each year. And with treatment, actually, in this clinic, we reduced their annual mortality rate to about 5%. So it's a pretty dramatic improvement in survival with just these medications. We also have 3 examination rooms. Right now, we're only about halfway remodeled, so we're using one of the examination rooms as a nurse check-in and triage room. So the nurses will see the patients here, and then once they've had their vital signs taken and are ready to see the doctor, they go back out into the hallway, where they'll wait along here to be seen in one of these 2 clinical rooms, to be seen either by a doctor or a clinical officer. You see the rooms are still very nice compared to most of the clinics in Malawi. These were some tables donated to us by a doctor in the States. The day ward is for our patients who are quite sick and need to lay down to get intravenous fluids or special medications, or just to lay down and recover while they're waiting to see the doctor. This is our chemotherapy chair. We do chemotherapy for certain AIDS-related cancers.
Before I came to Partners in Hope, I was having different problems like diarrhea, skin rashes, and even my legs were swollen. And by that time, I could not report for duties because of my illness. But when I was approached by John Hamilton, he brought me to Partners in Hope, and I went for testing and was pronounced to be HIV positive. My family, as well as the relatives, are happy to see that my life has been uplifted by the Partners in Hope through the ARVs. And now I can manage my own family by providing food through the work that I perform wherever I'm performing it.
But what I saw happen within the psyche, really, of Malawi when there was hope for treatment is that it changed the whole mindset about the AIDS epidemic. Before, there was no hope for treatment, and so there was apathy and recklessness. And we see that, in inner city situations, and even in our own lives when we're hopeless about the future. You only live for the moment, and you don't plan ahead, and you do what feels good for the moment. But I think the addition of hope for treatment started changing people's attitudes about talking about HIV, about getting tested, because now you go to get tested is not finding out whether you've got the death sentence, is to say, okay, well, I'm HIV negative, this is my path for staying negative. I'm HIV positive, this is my path for staying healthy with medications and nutrition and good support.